Right, I think we will start. I'm sure people will continue to join. Um, we are recording this, and this will be sent through to you afterwards. But look, a very warm welcome and thank you for joining what I believe is a very important topic around workplace mental health, this one focusing on men. MQ Mental Health Research has joined together with the University of York to look at workplace mental health generally. And there are going to be a series, and I'll mention those towards the end. But over the course of the next hour, we are going to look at men's health in particular in the workplace. So just before introducing the two guest panelists, just to introduce myself quickly. So my name's Chris Parsons. I have been a lawyer for the last 40 years. But during that time, I have struggled with my own mental health issues, and I went public with that in 2015. And I have to say, it was transformational for me because I was in a position where I trust my organization that I was able to talk about my struggles. And in particular, my struggles were around stress, anxiety, and depression, very serious depression, where I ended up on a number of occasions off work, under the duvet, crying, and I guess really wishing that I could go to sleep and not wake up again. Life was too difficult, too painful. And the reason that MQ have asked me to do this is that I used to sit on the board of MQ for 6 years. I stepped down last year. So I've got an interest not only in the sort of lived experience, but also in the research that goes to support things that we might be able to do to help ourselves and to help organizations. So our two panelists, first we've got Paul Galdus, and Paul is going to speak first. Paul is the Professor of Nursing and Men's Health at the University of York. And then separately, we've got Jeff Watts. Jeff is Operations Manager at Cadent Gas, and he has been very active within Cadent Gas around the subject of men's mental health, and you'll hear from both of them in a lot more detail as we go through. Just in terms of housekeeping, I mentioned it at the beginning, but I'll mention it again for those that have joined since. The session is being recorded and it will be sent through to you and your organization, so people will be able to watch it afterwards. And to remind all of you, please, to set out your questions. There'll be 15 minutes of Q&A, I hope, towards the end of this session. So please set out your questions in the Q&A chat section. Unless you want me to, I won't mention your name. So if there are questions you want to ask and you want to remain anonymous, that's absolutely fine. And I understand it in the context of this topic. So please do, I would encourage you to ask any questions that you want to. And with that, I am going to hand over to Paul, and I'm going to let Paul introduce himself and to share a short presentation that he's got for us.
It's great. Thanks very much, Chris. Good afternoon, everybody. Hello from quite cloudy and somewhat chilly York. I'll just share my slides. But before I get into, are they coming through okay, Chris? Can you see them fine?
All good, Paul.
Perfect, thank you. So before I get into a slide deck, I'm going to speak for about 15 minutes. But I just wanted to share a few personal reflections, because when I do these presentations, I often think about how best to start it, and I've been mulling over a few things that relate to my own personal experience recently over the last 6 months or so. I've had a few male friends and colleagues who have been struggling with their mental health, and I think despite been doing work in this field for almost 20 years, I find it very difficult still to know how best to respond sometimes when those people close to me are struggling. Because a lot of men, and you may know this from your own personal experiences or from those men that you know and love, do find it very difficult to talk or disclose challenges. And it can be very challenging when that happens to know how best to provide support, whether that's in your personal life or whether that's in the workplace. And I was discussing this with my wife recently, and she said, in a throwaway comment, that sometimes men don't help themselves in not being able to open up, and I think that's a big part of the challenge, is to not look at these challenges as being an individual men's responsibility always. Obviously, men do have responsibility for taking ownership around managing some of the challenges that they experience. But really, this is best understood as being a reflection of how we've socialized men in our society to be self-sufficient, to be problem-solving, to be emotionally walled off. The messages that a lot of boys and young men and older men still receive are that those are the things that are valued within society, and they are rewarded in society as well, and often rewarded in workplaces. And so these ideals have been internalized by a lot of men. And when I say internalized, I don't necessarily mean that people are always within themselves thinking about how they should best react. It's just part of who they are. And so a lot of men don't necessarily have the tools or are familiar in a manner that would enable them to perhaps open up. And sometimes rushing men to do that can be counterproductive. And hopefully, as my presentation will show you this afternoon, that there are other solutions that we need to think about. And it is a bit more complex than just asking men to open up. And these are some of the things that we often see in men's mental health. This is, it's topical in terms of it's football related at the moment, or I won't go into the football. But this is Vinnie Jones in a recent campaign that, in association with Chelsea Football Club, encouraging men to talk more about mental health, and more than just football when they're together. But in the absence of support that would enable them to do that, and an environment that would enable to do that, it really is unlikely to work, the evidence will show. And it really is a significant problem that we're facing, because a lot of men do experience challenges with their mental health over the course of their lifetime. If we look at official statistics, that suggests that about 14% of men compared to 19% of women will experience mental health problems over the course of their lifetime. But surveys consistently show that this is underreported. A more accurate figure would be around 3/4 of the male population experiencing symptoms of anxiety, stress, or depression at some point in their life. It is a common problem for men. But one of the big problems that we face in addressing men's mental health, both in the general population, but also in the workplace, is that many men don't speak out or don't talk about this, or feel unable to disclose their mental health challenges. And a key reason that we see a lower reported figure in terms of the official incidence of mental health in men is because of the underreporting of it. And this statistic, I think, really brings that home, that 40% of men have never spoken to anybody about their mental health. And that doesn't just mean professional health professional services, that means anybody, friends, family members, health professionals, nobody. 40% of men have reported that they have never spoken to anybody about their mental health. One of the reasons for this is down to mental health literacy, i.e., helping men connect how they are feeling with something that might be associated with a mental health problem that they might benefit from getting help for. And there's a significant and growing evidence base that the symptoms of mental health manifests differently in many men, and often men and those around them, and including professionals, can sometimes fail to recognize or not appropriately diagnose some of the symptoms around depression and anxiety. So men, the evidence would suggest, are more likely to experience anger and frustration, irritability, withdrawal, distractions, and more likely to engage in some unhelpful coping mechanisms when they are experiencing mental health challenges. Perhaps unsurprisingly then, if we look at the data, men are very much underrepresented when it comes to referral to NHS talking therapies. Only around 1/3 of referrals to NHS talking therapies are for men. And the evidence also shows that even when we get men through the door to access talking therapies, they are more likely to drop out early. Again, it's a big challenge that we're facing, and I think if we look at the further research around access to mental health support, we see that for many men, there has to be an incredibly high threshold for them to feel like they are able or willing to seek professional help. 40% of men have said it take thoughts of suicide that to compel them to get professional help. And that leads me to perhaps one of the starkest challenges that we face in this country in relation to men's mental health generally, is that suicide is a leading cause of death in men under 50 years old. And I've presented this statistic on so many different occasions, and every time I present it, it always gives me a shudder that suicide is the leading cause of death for men under the age of 50. Around 3/4 of all registered suicides in this country are male. It peaks between the ages of 45 and 54. And over the last 10 years, the number of men who experience suicidal thoughts has doubled to around 10%. So the picture is actually much more complicated, though, than perhaps what I've presented it. It's not just a simple fact that men are failing to engage or not willing to engage with mental health services, and that's leading to suicide. We look at the evidence, and this recent study from the University of Manchester shows it quite clearly, is that men who died from suicide in 2017, when the study was done, 91% of them had been in contact with at least one service or agency, one professional service or agency. And of those professional services and agencies, 50% of them were mental health services. So men are engaging, men are going and accessing services. But what we can read into it, and from the broader research underpinning this particular statistic, is that services are perhaps not meeting the needs of men in the way that they would prefer. And so if we can summarize the problems around men's mental health, it's at two different ends. It's first, that men often don't feel able to disclose their mental health problems and challenges. And then secondly, that current services are not very well matched to be responsive to men's needs. And to address the challenges of mental health in men, we need to tackle these challenges at both ends. And at both ends, gender norms and masculine norms are at the root of the problems, but also how we can find appropriate solutions. So when we talk about gender norms, we talk about masculinities, what we're referring to is the social norms that define what is acceptable and appropriate for both men and women in any group or any given society. And there are particular norms that are associated with health, mental health, and health-related behavior. So if we think of things like dietary consumption, alcohol, exercise, body image, men and women grow up and learn what is appropriate and what is normal within a given culture or a given setting for men and women. And we receive feedback on what is valued and how we should behave. And the workplace is a setting in which these gender norms and social norms can play out. So for boys, for young men, the norms around male appropriate behavior commonly position men in order to be strong, the opposite of weak, to be competitive and not be passive, to be in control and to not need help, and to be practical and action orientated and not be emotionally driven. Now, we don't behave like this all of the time, and many men won't always subscribe, maybe not even at all, to a lot of these ideals. But what's present within society, these are the ideals that are upheld as the most valued. And as I mentioned, the workplace is a setting which can act for the policing and the reproduction of these norms. So we get things like contest culture, hierarchies, a need for control and self-sufficiency, a need to be assertive, make decisions, how much you paid, the level of remuneration. And these things can be played out in different workplace cultures, but are particularly pronounced in male-dominated industries, which have been shown to have a much higher rate of mental health problems and suicide. So it's not just as simple as saying we need men to be able to talk and speak out, because if the culture in which they have been socialized, or perhaps the culture in which they are working in, acts to reproduce some of these dominant ideals, it can be extremely difficult, challenging, and threatening for somebody to be able to have the bravery to disclose a mental health problem that they may perceive as going against what is valued. And if we look at the evidence on men when they do speak out, many men do find it challenging. So in this recent study from November, 46% of men said that they worried about negative things being said about them behind their back if they were to discuss mental health issues at work. 36% felt that it could be held back from promotion, and 30%, almost 1 in 3 men, felt that the job could be at risk if they discussed mental health issues. And the same study showed that 2 in 5 men who have opened up to somebody else about their mental health regretted doing so. And the reasons they regretted doing so was they felt that either the person that they were speaking to didn't respect them, they either didn't care about the problem, or that they were not taking them seriously at all. And this it plays into one of my favorite quotes that I think sums up some of the challenges that we have around the current talk in the public domain about men's mental health, from Brené Brown, who said that men are often pressurized to open up and talk about their feelings and criticized for being too emotionally walled off. But if they get too real, if they start talking too much, or they're too honest, they can be met with revulsion, and there are real consequences around that. So men will talk, but we, as workplaces, as colleagues, as friends, as family members, need to be willing to listen and be responsive in the right way. This recent quote from one of our recent studies on men's mental health in the National Health Service, I think, again, sums it up quite nicely. It's quite wordy, so I'll read it out. And he said, there isn't any support in my workplace, and quite often it's laughed at, or you're made to feel like, oh, grow up. And it's a lot of these mixed messages. I think there's a lot of, oh, we need to open up more. And then when we do, it's like, oh, you big babies. I think men in general are in a weird place where we don't really know what kind of role we're meant to do. If you do get help and it's in your record, like, oh, you were a bit depressed 6 years ago, and does that mean that I can't do my job now? Am I going to be judged? You want me to open up? And Eddie can see from this quote that he was in a really difficult situation, and how am I going to, the things that people are saying about how I should behave might not translate into how people react. Again, this is made much more pronounced in male-dominated industries. This particular quote from a recent study on men working in male-dominated professions shows that. He said, you're not manly if you have mental illness, you're not strong. We're the hunters, we're the gatherers, you know? There's a lot riding on your shoulders to be this strong man, and if everything else is a sign of weakness, right? It's like a sick animal. The wolves go after the sick one. Just like that at work. Your co-workers, the wolves, are going to go after that lame deer. So going back to our challenges, if we frame this in the context of workplaces, we can say that we need to tackle these challenges at both ends, that workplace cultures are not always supportive of men seeking help or disclosing mental health challenges. And if they do, then some of the current support services are not always well matched to their needs. So our solutions needs to be around workplace values and culture, and in developing support services that reflect men's needs and preferences. So for the last couple of slides, I'm going to provide some examples and some of the evidence around what works in both of these areas. Culture and stigma, workplace culture and stigma, is perhaps one of the most challenging things to address. Stigma is a really complex phenomenon, and it encompasses very deeply ingrained beliefs that are likely to require much more than short-term intervention in order to bring about meaningful change. And there's not a great deal of evidence on what works in this area, but what we do know are that authenticity is really important in an organization. Genuine managerial commitment and buy-in is required in order to promote a culture whereby colleagues and male employees feel that this is taken seriously. The use of language in order to reduce stigma is also really important, and that's something that's been consistently shown across a range of different studies involving men and their mental health. So normalizing things, talking about staying well, managing stress, talking about mental fitness rather than mental health, being proactive, and really leveraging and working with many of the positive attributes that many men have in relation to their masculine identities. So the desire and willingness to provide support to colleagues, camaraderie, using humor, drawing on often men's willingness around loyalty to their colleagues, and being action orientated and problem solving. All of those things can be leveraged in a positive way in order to promote a culture that is supportive of mental health. In terms of individualized support or support services, gender is not often thought about in the design of workplace mental health interventions, or very much evident in the standards that guide the design of workplace mental health supports. And so a key recommendation for employers on the call, I would say, is to seek evidence, if you haven't already, on what men are currently accessing in your organization. Most organizations invest an incredible amount of money into mental health support services, but knowing which ones men are more or less willing to access and take up is key information in order to think about how to overcome some of the challenges, because we know that men will disclose difficulties, and we know that they will seek help if there is a safe environment and therapeutic setting to do so. And men's emotional disclosures are very much impacted by the ability of others to recognize and respond in a way that's consistent with their ideals and preferences. So some of the things that we know work in terms of providing a support service that is aligned with those things is co-producing with the men who are going to receive the intervention. So if you haven't already, and Jeff will speak about some of the work that he's done at Cadent Gas around this, is what the men in your organization want, what would be accessible for them, how should services be designed. We know that proactive early intervention is really important as well, not waiting until men are really struggling. Again, some of the evidence that I presented earlier on speaks to that. Confidentiality and anonymity is again another consistent thing that's shown across mental health services for men as being incredibly important. Providing support such that men don't fear that they will be threatened or there'll be significant impacts on their employment should they wish to seek out and get help. And normalizing language, practical skills-based approaches are highly valued by a lot of men, and those have been framed often in contrast to those interventions that are seen as just being about talking. And my final slide provides an example of the workplace support package that we've just developed in partnership with men working in frontline NHS roles. Well, we took a lot of these ideas, developed them into an action-orientated, proactive, early mental health intervention. And men really valued a lot of the key aspects that I've spoken about this afternoon, and were willing to access the service and found it beneficial. So there are real ways that we can design services such that men will access them. Key to those is speaking with men within your organization about their needs and preferences. That's all I've got. Thank you.
Great, thank you very much, Paul. I guess just one specific observation for me at this stage is you referenced, how people cope with issues around mental ill health, whether stress, anxiety, depression, etc. And part of my story, which I didn't mention earlier, was that I self-medicated for decades with alcohol, and I became an alcoholic. I am an alcoholic, and luckily in remission at the moment. But it was the one thing that sort of kept me alive, I guess, for a long time. The problem, of course, is that I then ended up with two problems, and not with one. So it wasn't ultimately the solution, but it worked for a time. So thank you, Paul. Right, we're going to move on to Jeff. Jeff, I'm really going to just hand over to you and to let you talk a little bit about, Cadent Gas, your role, and in particular, your role within supporting men within the organisation.
Yeah, thanks, Chris. And yeah, brilliant, Paul. That was really insightful and useful, actually. And yeah, quite thought-provoking. Yes, I work for Cadent Gas. We are one of the largest pipeline operators in the UK at present. My role is I'm an operations manager, and I'm also the chair of a employee community called the Men's Engagement Network. Cadent Gas is made up of around 9,000 employees, and around 79% of them are male, the rest being female. And in our field force, that is actually made up of 99.6% of our field force being male. Now, a lot of them are lone workers or working twos. And 64% of that is also the staff as well. So it's a very male dominated sort of industry and company. We're making great strides in to sort of change the balance, but as it stands, they're the figures we're working with. And yeah, sort of I've been working for Cadent now for about 11 years. My own journey has been a turbulent one. And for the most part of that, I've been working here, and I was a lone working engineer around 7 years ago. I went through various sort of mental health struggles, a family breakdown, and sort of I guess everything led up to that moment that I'd gone through in my life, my childhood, etc. I'd led up to a sort of a pinnacle moment, and it ended up with me being off work for around a year, and it all sort of started with a simple question. Very much like the previous slide said, I felt as though I had to sort of portray a certain character, a certain persona. I hid a lot of my emotions, a lot of my struggles. I kept them to myself. I didn't speak to anybody, but in fear of being viewed as unstable, bit of a mess, a lot going on, and again didn't want to sort of put any blockers or any barriers in for me to sort of climb the ladder, so to speak, and advance my career within the company. And in hindsight, that wasn't the answer, but I thought I was doing the right thing. And yeah, I sort of, like I said, suffered with a sort of a history of mental health. I had quite a turbulent childhood, and with the breakdown and everything, and it was just one day, a normal working day really for me. And I was in my van. I'd just been into a job, and I had an unannounced visit from sort of my director and one of the stewards, the union stewards, just doing a random safety visit, and they sort of turned up, and my van was always quite very well organised and tidy, and on this occasion it wasn't, and that was sort of a reflection of how I was feeling internally, I guess, at the time. And when they opened the side of my van just to have a little look and chat with me, they was quite shocked at what they saw, and they sort of looked at each other and looked at me, and they, it all started with the one question was, are you okay? And at that moment, sort of everything come crashing down, and I had a breakdown there on the side of the road. And yeah, sort of like I said, I ended up having a year off work. And during that year, that there was a suicide attempt that I did try, but thankfully, by the grace of God, I guess, is that didn't work, and here I am today. And the last sort of, I guess, 7 years from that moment, there's not been a linear path, and it's been a very turbulent, a lot of peaks and troughs, I guess, to get where I am now. And that's sort of what led me up to getting involved with one of our employee communities, the Men's Engagement Network. We've got 7 employee communities within our company that are brilliant, that offer sort of a safe space for everybody, very inclusive environments, very supportive environments. And 2 years ago, we'd noticed that we didn't have a employee community for the men. That there's a brilliant community for the women that work within our industry, that is run by an amazing group of women, very brilliant and talented, and they sort of inspired us really to sort of get going and get cracking on with the Men's Engagement Network. And yeah, and for me, the importance of relatability, having them personal relationships and authenticity is it holds so much weight. And I think in a world where we struggle to, the most simplest thing to do is to be ourselves, but we as humans, we struggle to do that. There's a lot of societal pressures and boxes that sometimes we feel that we have to fit into. And for me, I did that for most of my life, and it wasn't until I sort of let go of that and just became myself and was happy with myself that my life became a lot better. And I think with what we're doing within our industry and within our company is exactly that, is offering that safe space for everybody for that work within Cadent to express their emotions freely, and really sort of get to the crux of how they're feeling. And it's very much a very close-knit community. We're a large company, but one thing that we pride ourselves in is that we have a very close culture throughout our company, and that's something that we sort of I noticed and thought we can really capitalize on that. Clan culture can have a negative side, but it can also have a very positive ripple effect because of the way that the sort of relationships work within the individual networks. And the Men's Engagement Network is doing exactly that. And yeah, we're doing some brilliant work and some brilliant stuff. And yeah, I mean, a lot of where I am today, the contributions that I've had from my peers, from my line manager, from the support that I've had with my company has been second to none. I've been very fortunate with that. But unfortunately, that isn't the case for everybody. There's a sort of that they say it's the line manager sort of lottery. It very much depends on who you have as your manager, and who you have within your hierarchy would be dependent on how your experience is within work, and how confident and how safe you feel to speak up when you are facing an issue. And I think that's something that's one of our sort of main sort of subjects to push is getting the involvement of leadership, senior leaders, senior managers, and the board to sort of encourage that openness and that willingness to talk. And even though I disclosed my issues that I was having at the time, that didn't hinder me in my progression. And I was very lucky in that sense. But unfortunately, there is some cases where sometimes that does happen, and that's something that we'd like to tackle. Sort of one of our main subjects and one of our main pillars really is breaking that stigma down to create that safe space.
Great, thank you, Jeff, and thank you for sharing your personal story. That's a serious issue when you're so unwell that you need to have a whole year off work. I empathize with your position there very much. Can you just a sort of some practical insight? You said you sort of set up the group on the back of what the women were doing, but can you give us a sense of how often you meet, how many people would get together, and what typically you might talk about?
Yeah, of course. So we have weekly meetings via Teams. We also have in-person meetings bi-monthly. We've got sort of four pillars that we sort of work with, and they are being physical well-being, mental well-being, masculinity, and outreach. And those 4 pillars anybody can choose to get involved with, and it is really sort of an open forum really to choose to sort of come up with any ideas that we could bring to the table. Each employee community has a sponsor. We're very lucky that our sponsor is our COO, Howard Foster, who sponsors our group, and he's very supportive in everything that we want to do and achieve. You know, for instance, one thing that we've been working on, myself personally, is a workshop, a sort of a day's workshop around sort of, you know, mental resilience, you know, emotional well-being, coping mechanisms, and it's not a prescriptive workshop, it's more of a conversation and an open forum. We've now done a couple of these sort of to trial with all genders, and they went down brilliantly well. You know, one of the exercises we do is, you know, the mask we wear. So we get masks, and we sort of we talk about how we each day we wake up, we put on a mask, and we'll put on this mask that we put on, we'll want to sort of portray certain characteristics and attributes that we want the world to see, but there may be things that we don't want the world to see. And it's a very thought-provoking exercise that we do, and we sit down and we sort of do our masks, and we talk about them afterwards and sort of speak about you know, what we've written down on the mask, and it was remarkable to see how many people sort of had things in common or similar. And again, it's really about, you know, everybody experiences life differently. You know, we've all got our own frame of reference of how we walk through life. And I think, but the one thing that we can do, you know, as humans, is all relate to each other on an emotional level. You know, we're all humans experiencing this world. You know, it's that, you know, like the famous quote, you know, we're all simple humans but living a complex life. And I think that is very much the case when you sort of get down to the crux of it. And, you know, sharing stories and, you know, short story sharing is something I think that, you know, we once was amazing at. We'd gather around campfires at points of interest and share knowledge and share stories. And I think, you know, going back to that old very old model that's been around for civilizations, and just sitting around a table and having them open, honest conversations, you know, it does a lot of good. Just sharing your story can inspire somebody else to maybe share theirs, and maybe they think to themselves, well, actually, I'm dealing with something similar, I'm not alone in this situation. And I think that's, you know, that and that was one big thing that we took from this workshop we've sort of created. So that's one of the things we do, and a lot of charity work and a lot of active stuff as well. You know, we're doing the Three Peaks in June. We've just done the Edale Skyline Circular. There was 30 of us that have done that. In the Three Peaks in June, there's around 60 of us. And so it's a very sort of, we've got a lot of arms that are doing various different things. And at the minute, there's around 300 of us within the community, and there's around 10 board members. But it grows every day. Like I said, it's a big company, and Field Force is sort of one of our target audiences because of the nature of their work, being lone workers, and you know, and what they experience and what they see. They work in line with the fire brigade, the police, the ambulance services. We get called out to, you know, we are the emergency gas service. We have to get to a job within half an hour to an hour, and we see some horrible things and experience some quite traumatic cases sometimes. And these guys are very hard to engage with, and you know, that is, for us, is our main target audience, because they are the ones that are quietly suffering, like myself, and like we sort of have discovered through our sort of you know, going up and down the country, visiting various depots and speaking to different people. You know, there's a lot of that going on, and we really do want to try and engage with them to sort of, you know, because we feel that they probably could benefit the most as well from what we're doing.
Thank you, Jeff. And you talked about masks there. I think that there's a really big issue in this area around masks. I know all about masks. I wore a mask for far too many years. And it was only really when I opened up and told people about the real Chris Parsons that actually I suddenly could relax and, you know, breathe a sigh of relief, and for people to see that it was all right to be, you know, worried in meetings or concerned about how I was performing and things. And the great danger, of course, in this area is that we sort of assume everyone else is all right, and we're not all right. And because we assume everyone else is all right, we then sort of think we need to continue in that way. And I don't know about you, it sounded a little bit like me, that almost my body made the decision for me. I wasn't brave enough to put my hand up and say I'm struggling, but I went down to the gym one evening after work and collapsed and was rushed to hospital, and I had every single test imaginable done. And at the end, the consultant said to me, Mr. Parsons, I've got excellent news for you. There's nothing wrong with you. And of course, that was the last thing I wanted to hear. I wanted to hear that I had something rare and exotic that would explain how dreadful I was feeling. With there being nothing physically wrong, of course, there was just a mental health issue. Paul, just bringing you in here, do you have a sense of, if an organization is really in the early stages of trying to grapple with this stuff, do you have a sense of some initial actions that they might think about putting in place that can make a reasonably decent impact?
Yeah, I think, as I've mentioned in my presentation, that the first step to addressing the need, or the perceived unmet need, is to start speaking to those who need to use the service, and so putting together a group of individuals who can help advise on what they would prefer, what works, what doesn't work. If an organisation's currently just providing a minimal level of mental health support, or like I say, they're attempting to enhance that level of support, is what's currently being offered seen as appropriate or accessible, or is it something that people are really reluctant to use? And what would be attractive? I think those are the important things. We know some of the key hallmarks and elements of what works, but there is no one size fits all mental health service provision that is like the magic bullet for men's mental health. If there was, I would have been a multi-millionaire probably. And I think I use the analogy of physical health. If we're encouraging people, for example, to lose weight, we don't just offer a subsidized gym membership. We might also make sure that healthy food's provided within the canteen. We might also speak to people about what type of food they might find attractive to eat, because if the vegetables are just going to go uneaten, then there's no point me choosing what's going to be cooked. Cycle to work schemes might, a range of different options, with the acknowledgement that actually different things will work for different people and they'll have different preferences. And the same certainly is relevant for mental health. And it's not just about talking. That is one thing I say, is that some men very much value and want to open up in a group setting, but others don't feel ready to do that, or don't currently have the perhaps the skills, the tools, the ability to do that. So I think we mustn't go down a route thinking, a group talking based intervention or program is kind of the be all and end all. It's not. It's important, absolutely. It's important. And like Jeff's group, that can be a great forum for developing ideas. And it's like, I think what Jeff said about identifying those that are quietly suffering. Like, it's great to hear that, because it's always the people who are not coming that are the ones that are of concern. So how do you reach out to those who are perhaps not the proactive help seekers, not those who are willing to step forward? And from an organisation's perspective, I think that's important to consider as well in forming a group of people to help advise, not just those who are already enthusiastic, but can you get people in who are perhaps more reluctant, and that can help to identify those, like I say, that are perhaps more quietly having a difficult time.
Yeah, thank you, Paul. I mean, part of the challenge that I've sort of witnessed in this area is that organizations are being sent endless different suggestions as to how to address mental health in the workplace. And there are, literally hundreds of apps and things on the market. I don't know whether you have a particular view about any of those apps, things like Calm and mindfulness and that sort of stuff. Any thoughts on that?
Yeah, it's a crowded space, is what I would say. It's a crowded space, and there are a lot of technology-based programs and apps that haven't got a great evidence base underpinning them in terms of working. What we do know is that a lot of people download those, but then don't use them. So again, there are some that will definitely resonate with people, and mindfulness-based programs are one good example that are very, very popular, but they might not necessarily be appealing to others. And also, they all occur at different parts of the spectrum, and that's another key issue in those seeking to enhance the mental health support provision within an organisation, is that we need to think beyond just when you get to a very difficult point, having a support service there available. But are there proactive early intervention things that we can do more upstream in order to support people to develop healthy habits in the same way that we do with our physical health, say healthy preventive habits. We don't start doing those necessarily when we become poorly. We know that it's good for our physical health to take those actions, and so there are all different types of solutions that are currently on the market and available that will enable points of intervention at different points along the mental health spectrum. But I think overall, I would say tread carefully into that space around technology and apps, because there seems to be a new one almost every day, and not necessarily entirely backed by science.
Great, thank you, Paul. We'll move to Q&A in a second. My own experience has been that having senior people share their stories within the organization was a real catalyst for change. So I was very struck, Jeff, when you mentioned about your COO being the sponsor of that organization. Have you, just out of interest, Jeff, had senior people within your organization standing up and willing to tell their story in a way that you just have?
Yeah, we definitely have. I mean, even as of recently, we have a conference every year called the Safe and Well Conference. It's a sort of the whole day, a day's agenda, around sort of 600 people, senior leaders, middle management come together, and we sort of discuss things that are going on within the company. And I had the privilege of speaking at that event, and before me, our actual owner, Sir Adrian Montague, he actually spoke on stage, and he's in his sort of mid-70s, late 70s, and he actually spoke about his own experience of dealing with grief and how that affected him, and actually cried on stage. And to be honest, before he spoke, I was going around all day in my head, because I'm an emotional person. When I'm talking about something I'm passionate about, naturally, emotions flow, and I wanted to remain composed. And after seeing him and how he was and how vulnerable he was with the man, who basically owns the company, to see that was inspiring, and sort of then led me to feel more comfortable in my own speech. So yeah, it's something that's happening more and more now. And I think, as you mentioned, it does help. It has a domino effect. But that, as Paul obviously also mentioned, it, not everybody feels comfortable or has the confidence to speak out. And from what I can see, the tried and tested method for me, and which is laborious, is the grassroots approach. Is getting out there and seeing individuals and being within the networks, having a presence. Not just over text or phone or email or apps. It's being there in person. And I think that's our biggest battle, because of how big our company is. But yeah, they definitely are, and it does definitely help, and the tides are changing, but there's still a lot of work to do.
Yeah, thank you, Jeff. That's certainly my experience, that having people very senior giving permission, effectively being seen to be vulnerable, and therefore encouraging through their own vulnerability, other people sharing their stories and things. And unless you've got the senior people within an organization willing to make the place safe, then it's very difficult for people to open up. I completely agree with that. Okay, we're going to just turn to the Q&A now. I'm conscious of the time. So the first question was just around employees versus non-employees. So employees, there are things clearly offered. And there are therefore far less offered to people who are not employees. Any particular thoughts on that distinction and how one group might be able to help? Paul?
Yeah, I think that's a relevant point. The workplace has been identified as a key environment to support men's mental health, absolutely no question. But obviously, where all efforts and interventions have been delivered within the context of the workplace, that will naturally exclude a range of individuals who are not currently in work. Or importantly, actually, when we think about the workplace environment, we need to think more constructively about those who are working remotely as well, and how the workplace has changed, and how can we best intervene and support individuals when they're not physically in a work environment in the traditional sense. So there are a range of different considerations that need to be taken in the design of mental health interventions so that they're accessible to people right across society. And as I sort of emphasised, there is no one size fits all. We need to do much better at delivering mental health support for all of our population right now and make them more accessible, not just those within the workplace. But the workplace is key, absolutely key for as a point of intervention for men. We know that.
Thank you, Paul. But part of the challenge that I've noticed within our organisation is that I rang up just to sort of test, because I'm interested, to test what it would be like to call up as a user to say, look, and I explained to them what I was doing, so I wasn't fooling them in that sense. And I said, look, if I was struggling with stress, anxiety, and depression, how would it all work and things. And actually, it was an amazing service, and I was put through to people, and I was handled, carefully and gently and thoughtfully, and all of these sorts of things. I then separately decided to ask our HR what percentage of our workforce has called this in the last year. It's 4%.
Right. Okay.
So I think that really goes to your point as well, Paul, is what would people find helpful? We think we've got this amazing service and we pay a lot of money for it, and there are all kinds of experts there at the end of a line who can help and support us. But if people don't feel comfortable with picking up the phone to that sort of organization, then it's hopeless, isn't it?
Yeah, absolutely right. And I think, as I've mentioned, getting information and data like that on who is accessing it, and how does that square with the things that we see in relation to things like sickness absence, and is there a disconnect between people's needs and what's currently been provided? Because there are a range of options there that we've talked about, different types of support interventions, different things that can be done from a grassroots perspective, like that Jeff's spoken about.
Thank you, Paul. There's one, not surprisingly, from somebody anonymous, saying that many companies have a sort of culture of just almost the survival of the fittest. It's almost Darwinian. So the individuals within those organizations, there may well be keen not to share knowledge or to cooperate or help others, because if you're doing that, then somebody else is going to be promoted and not you. Just any thoughts about really tough work cultures where it is sort of dog eat dog?
Yeah, Jeff might want to chip in, but I think my initial thought to that is it sort of speaks to a criticism around the development of mental health support in the workplace that's focused on the individual, which have been criticised for not focusing on the real problem, which is at an organisational level. And things need to change at an organisational level to provide a healthy workplace. The NHS has been, if you look at the literature on mental health support for people working in the NHS, has been very much criticised for that, in so much as the working environment, individual mental health support has been orientated around developing resilience in individuals. But then the criticism has been, we need to create a system that doesn't require people to be so resilient in order to be able to flourish there. And you know, all the evidence shows that well-being is correlated with increased productivity and job satisfaction. So it makes no sense to create an organizational culture that doesn't support that.
Yeah, thank you, Paul. Any thoughts from you, Jeff, on that?
Yeah. I mean, it's something you know, we try to tackle within our own company, and I think the trouble is sometimes leadership managers can often focus too much on the input from individuals and not so much on the output. And I think if we look at an individual's output, their performance, and if they are, you know, underperforming, then we can sort of look at that and ask the question as to why. And I think, again, that culture that a lot of companies have, the close-knit culture within the smaller pockets, is something that we can use to an advantage, something, those close relationships. And I think, you know, the encouragement of mentorship and training and teaching others, and the fulfillment that you get out of that is something that we do quite well within Cadent. So from my own experience, you know, I was mentored and I am mentored now by senior leaders, and they take time out of their own diary and their own day to help me and guide me in anything that I may want to pursue. And I think we can do that on every single level of the hierarchy. And I think, you know, there is that you know, that they rightly said around underperformers sort of being let go without really focusing on, you know, why are they underperforming? Is there something we can do to help and nurture them so they can become better in their role? But yeah, it's definitely a difficult task to tackle, but with the right leadership and the right environment, you know, anything's possible.
Yeah, thank you, Jeff. I mean, I certainly agree with that. Look, we're coming to an end now. The other couple of questions, one was on signposting, which I think, you know, that's really important, that all organizations should have clear signposting for those that are struggling, so you know where you can turn to for help. And then there was another question around training and development and treating people properly, which is all around workplace culture, which Paul, you sought to address as well, and you, Jeff. So look, I'm going to wrap up now. So I'd like to thank you, Paul and Jeff, very much indeed. Please look out for future webinars that MQ Mental Health Research and the University of York will be putting on. In terms of topics, having looked at men's mental health, there's one on loneliness, one on the importance of prevention, and then the final one is around the role of first aiders in an organization. There are lots of ways that you can get involved with MQ Mental Health Research. Please do have a look at their website. And part of what they do, I know, because it was one thing that I used to bang on about when I was on the board, was around workplace mental health. It's something that is very, very close to my heart. MQ is working also with Virgin Unite and 100% Human at Work to look at producing a leadership playbook on how to build mentally healthy organizations. So please, if you're interested in that, then I think there was going to be something in the chat around where you can get details, but irrespective, go to the MQ website and you'll be able to find something on that. So look, we haven't really scratched the surface of what is an incredibly important topic, but thank you again for joining us, and do please look out for future editions of what MQ will be doing in conjunction with the University of York. So thank you very much indeed, everyone.
Thank you all.